today we will be discussing about cystic fibrosis. In this episode, we will be discussing about the management guidelines in a case of respiratory exacerbation in a case of cystic fibrosis. Because it is a long topic, I have divided it into different sections. So make sure you check out all the videos to update yourself about the recent guidelines in the management of cystic fibrosis. So let us discuss today about the respiratory exacerbation guidelines. So how you will recognize an exacerbation? There will be respiratory changes, that is increasing cough and sputum production, breathing difficulty, that is increased dyspnea and coarse crackles, systemic signs like weight loss and decreased appetite, and hemoptysis. Now, what you will assess when a patient comes with respiratory exacerbation? First thing is to send a sputum culture, obtain the sample before starting antibiotics. Consult with CF team, cystic fibrosis team. Review the history, check the previous IV antibiotic regimens and initiate treatment. Start appropriate IV antibiotics promptly. So, what antibiotics you will start? First line IV antibiotics you will start for patients who have never been treated before with IV antibiotics and currently have an exacerbation. If you suspect Pseudomonas, you have to give ceftazidime plus tobramycin. Ceftazidime is given in the dose of 50 mg per kg 8th hourly and tobramycin 10 mg per kg once daily, and monitor the trough levels of tobramycin closely. If you don't suspect Pseudomonas, what you will give is cefuroxime 50 mg per kg 6th hourly and adjust based on culture results later on and review the response regularly. So, when you suspect Pseudomonas in a patient, you give ceftazidime plus tobramycin. Ceftazidime 8th hourly 50 mg per kg and tobramycin 10 mg per kg once daily, monitoring the trough levels. And if you are not suspecting Pseudomonas, give cefuroxime 50 mg per kg 6th hourly. But this is a patient who was never given IV antibiotics before. But if the patient was already given an IV antibiotic in the previous exacerbation and it worked well for him, you will be able to know it from the notes. So, start that IV antibiotic, same antibiotic which was given in the last exacerbation, or you can discuss with the CF team regarding the plan. Okay, so if never given before IV, you treat as per this, or if before was given IV, you discuss with the CF team, or if you are not able to discuss with the CF team, start whatever antibiotic was given in the last exacerbation. Now, I said tobramycin trough levels have to be monitored. Which all days you will monitor? It is day 2 for the first trough level check, day 8 for the second trough level check, and the target is to maintain below 1 milligram per liter. Trough level means the level in the blood before the antibiotic dose, just before the antibiotic dose, you have to check. Okay, Tobra you are giving once daily. So, before giving the antibiotic, you check the trough levels on day 2 and day 8 and maintain it below 1 milligram per liter. That is the goal. Now, so we have talked about antibiotics. So, you will send the sputum culture and start the antibiotics as per the way we discussed. So, if Pseudomonas suspected and not suspected for a patient who is receiving IV antibiotics for the first time, or before if he has received already, give whatever has been given in the last exacerbation or as discussed with the cystic fibrosis team. So, after antibiotics, what you will give? There should be a nebulized therapy, isn't it? So, what you will give is bronchodilators to open up the airways, nebulized antibiotics, and you will use nebulized antibiotics, tobramycin, and then physiotherapy, which is very important part of the treatment. And you will give nebulized mucolytic agent also, which is Dornice alpha. So you are giving IV antibiotics, but there is no improvement after 1 week. After 7 days, you are not seeing any improvement in the patient. Consider adding steroids. Prednisolone you will give 1 mg per kg per day orally. In that scenario, you have to always think about allergic bronchopulmonary aspergillosis also, SEN4, total IgE and specific IgE. And then if EBP is diagnosed, you will give a dual therapy. That is, you will continue the steroid therapy and add the antifungal treatment. So you will give a dual therapy with steroids and antifungals. So what all we discussed? First, we will culture and consult. Do sputum culture, consult the CF team. Start IV antibiotics based on history or the first line protocol. Nebulized therapy, that is bronchodilators, antibiotics and mucolytics. Reassess on day 7 and add steroids if no improvement, and adjust the treatment modify based on culture results. So what are the key takeaways you learned? You have to recognize an exacerbation early. It should be a culture-guided therapy. Monitoring matters about the drug levels and regular assessment. And it should be a multidisciplinary approach. Collaborate with CF team throughout.